Never mind. Okay. So it is basically an artificial process. An artificial process is not natural. Okay? Now I have given you a list of what is active, natural, passive, natural. Have I? Induced? No? You don't find the list that I gave you initially? Natural protection and artificial protection. What does it mean? It can be both. Be natural infection is what? Natural protection. Or acquired. Forgot everything? Do I have to repeat everything again? Never mind. It's actually an artificial process by which you are going to render your patients immune to many of the diseases. Now they can actually be a lot of these bacterial antigens, viral antigens. You can induce it actively, you can induce it passively, okay? And it is important. It is important that we protect ourselves from these diseases, from these infections, because they may be very lethal infections. And that's why many of us who are still here has been immunized. We have been immunized from early childhood, and we don't get the disease again because of the memory and spacity that our cells have. However, there is no memory and spacity if you induce a passive immunization process, which is through preformed antibodies, immunoglobulins. So now what is an active form? An active form is attenuated. Sometimes they were giving live vaccines, a little bit. Attenuated, DNA vaccines. These are some of the things that you're giving. If you give a pure, if you don't give a killed vaccine, what happens? The person to whom you are giving the vaccine will have the full load of disease, the same one, because it's a live virus. So when you change it and it cannot multiply anymore, yet their DNA is an important factor, and we produce antibodies against the DNAs of the virus and the bacteria, and we don't get the disease, we get some symptoms, normal symptoms. This is natural because there is something which has been injected into the body. This is normal for our T and B cells to work. So what happens is, as you give it, we produce antibodies against it. Now it does take time. In the initial response, I have told you, primary response, it's delayed. It's not immediate. So what happens then? When it's delayed and eventually the immune system starts working, you are protected. So if the same disease comes back to you in natural form, then we have a sudden onset of rejection of these microorganisms, and we don't suffer the same disease. Now, say for instance, I have been vaccinated against flu, the different DNAs of the flu. I'm not getting the flu. But last week I had some symptoms because some person that I came in contact with actually injected some virus in me. But though I'm protected, I will not get that flu symptoms. Yet I felt a little bit unwell, and I thought, okay, that's a natural trigger because my immune system has memory and spacity. So it was fighting off that infection. That process made me a little unwell. But little unwell means only for a few hours. I didn't suffer the chaotic scenes of a full flu infection. Now, so what you have done is, when you are in the well baby clinics and other things, you need to check whether the child has been immunized against the known antigens that vaccination procedure requires in this country. So every country has their own requirement of what should the vaccinations be in the first 3 months, first 3 years, and so on and so forth. And you have to see that those are vaccinated, otherwise it's going to be a big problem for the patients. It's going to be a big problem, even normal individuals. It's not patients, they're normal individuals. We don't want to get diseases that we cannot tolerate, that we will have problems. Now there are some vaccines which are basically a question mark. Now, it is very important that we should be protected as a child from pertussis. Pertussis is whooping cough. Do you know what a whooping cough is? Anyone? Anyone? Whooping cough, vigorous coughing, continuous, and it can be fatal. So now the question here is that if a person or a child has whooping cough, there is a remote chance, maybe 1%, 2% chance that the baby may have brain damage. It has been proven. But if you have to vaccinate 100 children, do you take into consideration that 1% or 2% of those will suffer some problems, some after effects, or would you like to completely abolish the vaccination? No. You have to see that majority of those individuals are vaccinated. Some may have reactions. You may try to control those reactions. It may be a very, very remote chance that one of them may have some brain damage, something may occur. But then that's a chance you don't know. That's a chance you have to take. Vaccination process these days is a simple process. It is achievable, and also that we have no long-term effects on these vaccinations, yet the protection is lifelong. So you must understand that. Now, if you look at what you are going to immunize an individual, you are going to immunize with immunogen. Immunogen. You know immunogen? These are particles. These are vaccines which have been killed, attenuated, DNA vaccines, you name it, they are called immunogen. So what comes in allergic reaction? What's the antigen known as allergic reaction? I know, but it's called an allergen. This is called an immunogen. And what else you induce in patients? Intolerance. You want to make a person tolerant to something. What antigen would you inject or give? Nobody? All of you forgetting. Tolerogen. Okay? Antigen, tolerogen, immunogen, allergen. These are some of the words which have been given. Remember what I'm telling you. Don't miss it. If you miss it, then obviously you lose marks on it. Now, the question here is, the function of any response, immune response, should have a long-term effect. It should also have memory and specificity for those infections. Now, which are the cases where you will see that these vaccines don't take in? Where these vaccines cannot be taken in? Where is the vaccines not given at a particular time of? Tell me. Immunocompromised. So if a patient is immunocompromised, all right, then obviously there's a problem. So what you do is, even if you give to an immunocompromised, you have to look whether in the patient they are capable of protecting themselves through these immunization process. The other one is pregnant ladies. In pregnancies, you must avoid giving these immunization processes. So there are many, many instances which you will think in your clinical practice that you may not be able to, for that period of time, able to give these vaccines to people who may require it because they are immunocompromised, because they are immunodeficient, because they are pregnant, because the people who are doing this are actually sick at that particular time. So unless a person is well enough, you should not inject these vaccines. Now, what happens is, the function of adaptive immune system, adaptive, which is called specific as well. What does it involve? What does it involve? You don't want phagocytic and neutrophil functions test this. You want acquired, specific, memory and specificity. What do you require? T and B cell functional, correct? So this is what you would require. Now, this is just a repetition of what I'm trying to tell you. All right? You must remember whenever you are doing this that immunization can be achieved in individuals. If it's a shorter period of time, you give passive or humoral preformed antibodies. That's very short. If you want a longer term protection, you have to give vaccines which are DNA particles, killed, attenuated, vaccines of bacteria and viruses which will maintain the system of memory and spaciousity and produce protection against several of these infections when we are challenged. That's the basic message that I'm giving you. So please don't deviate yourself too much into other things. If you need to ask me, ask me. Now, if you look at this here, the immunity can be natural. Natural? What do you mean by natural? Come on, everyone is sleeping. If I get a natural infection, I'm protected because I had the vaccine, correct? What's acquired? Immunity can be acquired. Yes, absolutely. And it can be both passive and active, correct? This is short term by immunoglobulins or preformed antibodies. This is by actually DNA particles, killed or attenuated type of organism. If you remember this, you remember everything. So you don't need to go through, I'm not giving you charts of what you should do. But what I'm trying to tell you is there is childhood protection. Yes? Yes, these are antigens. These are actual antigens, solid antigens.
And the body make antibody against?
Absolutely, all the time. And the body will have T and B cell memory of that particle, of that antigen. Yes. All right? So these particles are very important. These are solid particles. Now, what you can do here in the passive is again artificial. What does it mean, artificial and natural? Come on.
Artificial immunization.
Artificial is through preformed antibodies, correct? This is passive, right? Passive always humoral. Don't put any particles in there. They are short-lived. They are artificial. You want to inject me with hepatitis A? Inject me with preformed serum. Some people who had hepatitis A, you take out the serum, they do it there. You don't need to. And you inject into me. I'm protected for 3 months. After that, it goes. T and B cell doesn't play a part because they did not encounter a solid antigen. They did not encounter the DNA of the vaccines or anything. It's clean. It's only immunoglobulin. So it's a protection, right? If you take into natural, mother, it's protected. So, it's so simple. If you just put your thought into it, you will know what it is. Now look at the active form. Active is particles, DNAs, attenuated, live, dead organisms which can be injected into you or into me or into anyone. And the other one is natural is if I am not immunized against measles and I get a measles infection and I pass over that infection, correct? I'm okay now. I have exactly the same, maybe better immune system, more better memory against measles. So that when I suffered measles, I did natural measles, I never had measles throughout my life. Or chickenpox, once in a lifetime. So many of these diseases that we get, now we don't want to go through the process where there may be dangers, okay, there are problems, so we vaccinate ourselves. But if we say, no, we don't need to anything, we just need natural infections, and sometimes in families, within your families, my families, everyone needs to have a chicken pox. So when the chicken pox happens, you don't get chicken pox, and most of the younger generations in the family, they all get chicken pox. It passes off with it, but they are protected into further chicken pox infections. So that's the beauty of it. Now, what you do, active vaccination. Now, I might ask you these. What do you mean by active immunization? Okay. Basically, is a foreign molecule. It has nothing to do with your body. It's not a self. It's a non-self particle. All right? Non-self particle can be anything, X, Y, Z, doesn't matter. But they are foreign to us. They are not self. And when we encounter those molecules, okay, then we create a lot of these antibodies with memory and spacity. Now, what happens in certain of these vaccinations that we have? We take the microbe, okay, or microorganisms. We feel that if we leave it as live vaccines, then obviously there is a problem. So we may extract the DNA. DNA is sort of a antigen. What is it called here? I just told you. Immunogen. They will act as a foreign body particle in our cells, correct? Look, I'm trying to re-emphasize to you so that you don't forget. I know you keep on forgetting, and then last minute you keep on reading, oh, my midterm. No, it's not a midterm. It's going to be your clinical practice. So why don't you understand that it's not for midterm or final? It's your clinical practice. You will come across these cases and how you should treat them. Now, what we usually do is one of these infectious agents, we pre-treat them and actually attenuate them. You know, we sort of feel that if we are going to give this vaccination, that the person to whom this vaccination immunization is not harmed in any way. Now, it does not mean anything that you will not get some of the symptoms. You may have some of the little symptoms of this disease, but it doesn't mean that the virus is spreading or the microbe is spreading in the body. No, it is not. It's a static form of antigens which is there, which against our cells react, produce antibodies, produce memory and spacity. But if you get little symptoms, then obviously what will happen is that these may be a natural phenomena of how the immune cells works. I tell you, last week in England, in a particular school, children's school, 220 children and teachers were sent home because all had flu. All had flu. Now, they said school is closed because we have a mass-scale flu infection within the school. Now, what they found out, that all the children had nasal spray. You know, flu, I got a vaccine here with a needle and syringe. In children, there is a spray. So they spray it in the nose of the children. Somehow, the symptoms in the children, which happened possibly maybe due to the vaccines that was provided or to the nasal spray that was provided, these vaccines, gave a reaction to these children which were much harsher, which was harsh, which actually these children had actual true symptoms of flu. All right? Because this flu virus, they keep on shedding for a certain period of time. So now the question is, if we have a reliable source of these vaccines, then we are okay. Now there is another story behind it. These vaccines you don't pick up from the shelf and give it. When it comes from, say, Pasteur Institute in Paris, these are modified, beautiful, immunized agents, particles, right? It has to be transported at a particular temperature. It cannot be exposed to sunlight. It cannot be exposed to just ordinary air that is going around from one patient to another. These are well protected. When you take this, otherwise there is no potency in these vaccines. They lose their potency. So what you are injecting, or your nurses are injecting, or somebody is injecting, you don't know whether these vaccines are active or not active. But you can only make sure that these activity of the vaccine remains in the vaccine if they are well stored. So there is a certain temperature under which you must store. You must pick it up right there and give it to the individuals that you need. Not that these vaccines are lying around. They will have greater loss of potency if you leave it like this. Then what's the point in injecting the person? The person has not fully developed the immunity. There's no memory and spacity. The person, when the real infection comes, they will have the infections. So this may be a good form in, what happens. You are working in a clinic. You have nurses and boys and girls or whoever with you, and they are supposed to be responsible. If they are not trained properly, then they will misuse these vaccines. You are not sure. You will tell somebody, okay, I need the vaccines to give this, and this vaccine has been lying there for 24 hours or 48 hours somewhere on the shelf when it should have been in a fridge at a controlled temperature. And you give it without knowing it's going to do more harm than actually the benefit that you can get out of these vaccines. So again, as I said, you must take precaution as far as these vaccines are concerned. When you take a particular microorganisms, you just don't take it like that and kill it, because the DNAs are intact, right? You treat it. There's a treatment process through which these particles you derive, or the DNA you derive from these microorganisms, are potent. All right? Not that you just treat it and destroy the whole characteristics of that particular DNA or whatever it is. So there is a process through which these goes through, and when it goes through, then obviously you get a good potent vaccinations. Now, as I said it, I'm just telling you for your knowledge. I'm not going to ask you in this examination, okay? I only want you to know what passive and active immunizations are, natural, acquired, etc., etc. All right? And you should tell me. And yeah.
Natural, passive.
Aye?
Natural, passive, natural. It's coming from the mother.
Yeah.
What's the difference between it and the natural resistance?
Look, if you give an antibody which is preformed in a passive form, right? Whether it's coming from the mother or you are injecting people with preformed, the protection in individuals will be specific for the one type of passive immunization that you're giving. Mother has created antibodies against all her immunizations, whether they are polio, measles, mumps, rubella, you name it. Maybe she had a chicken pox. These protections are actually gone into the baby. The antibodies are there for a specific immunized agents. So the baby is protected from more of the diseases than an individual who only has one vaccination or antibody that you give for a short-term protection. Both passive or humoral immune, whether it's from the mother, whether you give preformed antibodies, the period of protection is very short. It's only about 3 months. All right? So if you're going back again, you need to get another shot. All right? You understand this? What's wrong? The problem here, I think they're going to hijack the room soon. Looks like it. Never mind. Now, serum therapy can actually, now, we talked about vaccines, have I? Active, passive, long-term, short-term, no question about that, correct? Now, you are sitting in your clinic. I'm taking you a factual, and you come, you receive a patient who is bitten by, say, a dog, rabies, or somebody has tetanus toxoid, okay? Somebody has diphtheria. These are some of the protections which has not been imparted into the humans. So if they come with a disease, and they come and you know that this particular organism, bacterial, will release toxins. Toxins are very potent destructor of many of the immune cells. They'll kill it. Patient dies if you don't treat the patient. What would you do? What would you do? Now somebody has bacteria which are releasing toxins in my body, like diphtheria, like tetanus. What would you do?
Preform antibody.
Huh?
Preform antibody.
Yes, what you do is immediately you give artificial passive immunization. So in emergency situations, this is an emergency treatment for toxicity because toxoids are made. So in the body, you want to finish off. You can't just drain it out. You can't do a dialysis or things like that. So what you have to do is neutralize the serum which has got a lot of toxins. What would you give? You will give antibodies, okay, by injection in the treatment. And these antibodies or immunoglobulins that you give it to the patient, which is yes?
Why wouldn't I give it antibiotic?
Look, toxins has spread, this particular one, of course you will give. It's not that you will not give. You will give the treatment. But toxins are so massive, toxins are being created by these microbes that you need to immediately, so that it doesn't get into the brain, it doesn't go into vital organs, what you do is you want to neutralize it. So what you would do is, this serum which has been collected from people who had previous infections have anti-toxoid material. You understand now? Immunoglobulins. As somebody had hepatitis A serum preformed, same thing with people who had this infection before, they collect or they maybe inject animals. They actually inject animals. So what they do is they take horses. They inject the horse with, say, tetanus. I'm just giving an example. The horse will produce large amount of antibodies which is against tetanus, correct? Now, the question here is you can't give this immunization. What you're doing is you're immunizing this patient for a very short period of time, not against the antigen of the bacteria. You are creating nothing. You are giving these immunoglobulins or antibodies which have potency, which have affinity, let's call it affinity, or specificity for those toxins. So now you have an antibody, and I've told you what the immunoglobulins antibodies are, which are specific for toxoids. It will go and bind the toxins. So all the toxins which are floating around will actually be neutralized so that it's not free to go and destroy the organs and the cells. So what you do is when you may you may have a situation like this where you have to take immediate action, otherwise it may become fatal for the patients. So you have to protect immediately. Now in certain instances, if somebody had a needle prick, you go and wash your hands, right? And what you do is you go to somebody and say to the employee, say, look, I have a needle prick. I don't know, it came from HIV or hepatitis or whatever it is. What would you do to these patients? Quickly. You can't treat a patient because you don't know if he has the infection or not. What you can do is you can give interferon, gamma interferon, so that if there is a virus, it will not replicate. What later on you can do is pump in antibodies. So if there is anything which has been created, it has to be neutralized. All right? So you try to protect the patient from that point of view. This is also called, this is basically produced in the animals, as I said, because animals can give a lot of antibodies. Now, when you take this serum therapy, immunoglobulins or from the horses, there may be a chance of anaphylactic reaction. Do you know what an anaphylactic reaction is? You had your PBL, man. Okay? Yeah. Because the serum that you are deriving from horses is not human. It's in the horse. So you may have antibodies, you may have reaction against the horse, which is called, Walaikum salam.
Come to human being now.
Yeah. Sir.
12 बजे के बाद इनको कहते हैं कि ये 12 बजे यहाँ मौजूद है.
Okay. I will do that.
Like after the horse will come to the human being.
Yes. Okay. What he is saying is, after 12 o'clock, you should be gathered here. That's what he's saying. Okay, you have a function or something. Now, so a person who is having an anti-species antibody from a horse or other animals which has been created, it protects us fine. But it can give us an anaphylactic because we have not encountered anti-species type of antibodies. It's an animal. It's not human. So we may suffer an anaphylactic shock. I'm not saying everyone. It's a rare. It can happen too. And also, it can give us serum sickness. You know, it can give us abscess, sterile abscess, not contaminated, sterile abscesses. So anything to do with anti-species, taking it from the horse or the animals and giving it to the humans, has certain amount of risk. But we have to do it because we can't produce those antibodies in the humans and then take it out and pump the humans' being. So it has to be done in animals, right? So the other way of doing this, which is also what they are doing, is to protect individuals with serum sickness, with anaphylaxis or anaphylactic shock, by actually training the human cells, growing the human cells, okay, or from myeloma cells. I'm just giving an example. And injecting into that an antigen which will produce vaccines by these B cells. You know how you produce monoclonal antibodies? It has been told to you in the practical session. You know how you make monoclonal antibodies? No? Read it, man. Okay, there'll be about 4 or 5 questions from your practical sessions. Easy ones. So now the question here is, it is very important for you to see that the vaccine is a potent vaccine. It can give you results. It will protect you. If it's an anti-species antibody, you expect certain amount of reactions which can happen, but these are reversible reactions. So now what they do is they have cells in the laboratory, human cells. Those human cells which are producing antibodies, if it is challenged by an antigen, which is microbe antigen, and they produce antibodies in mass scale of human cells, then this problem of anti-species antibody will vanish altogether. Anaphylaxis will vanish. Now, anaphylaxis is a procedure which I'll teach you in allergy, okay, is something which not everyone suffers, but some of them will suffer. And there are many different agents through which we all may suffer. I'm not saying all. People who are prone to anaphylactic shocks can have. So I'll teach you this in the actual lecture that I have for allergy. Now, I want you to remember this. Passive immunization is actually prevention by immunoglobulins or preformed immunoglobulins, okay? It's immediate and it can last for a few weeks only. So they are specific immunoglobulins against which you protect for a temporary period only for a few weeks, not long term, is through passive. And it's normal immunoglobulins that will also protect you. Remember this. Passive, humoral, same thing. It's fluid form. All right? There's no antigens there. Active is when you actually inactivate, attenuate live organisms, their products, DNAs, and you can have all these measles, mumps, rubella, polio, etc. Then you have inactivated one. You can have bacterial viral vaccines. Read this. It's the same thing which I'm telling you. It's only the names of some of these agents that you see here. Now, the question here is, what do you get out of this? Okay? I'm just telling you. Wa alaikum assalam wa rahmatullah. Fine, thank you.
Do you want to just install something in the back, if you don't mind?
Yeah, carry on. Okay. Carry on. So, the actual active form of immunization, yeah.
Just I'm asking them to focus with you.
Yeah, don't worry. Yeah. As you can see, they are very attentive. You know? Oh, thank you. Thank you, so Dr. Khoja, thank you. You know him? How do you know him? Yeah? How do you know him?
He teaches us.
He teach you. His father is my colleague, Tawfiq. Tawfiq and myself, we were in King Khalid College of Medicine in King Saud. Okay? So I know all the children that he has are going for medicine, right? They are medicine destined people, right? But they are good people. Now, I might have to cut short a little bit, but don't worry. So now what you have is, if you inject active immunization process, and active is through particles change, these are microorganisms, DNA attenuated, then you will have a primary response, and then you have a secondary response. Do you know the difference between primary and secondary? Again, you forget, man. The first response is IgM. Only for a few days. The IgM will go and IgG will actually come up. So your protection is not IgM, your protection is IgG, because that is the long term. Please remember all these. Otherwise, I'll see a lot of failures in midterm. No, I don't want you. Now, look at the types of vaccines. Now, non-replicating vaccines. Now, you have to remember this slide, because you can have killed whole virus vaccines, which is killed, subunits of the vaccines, like strain 1, 2, 3, like meningitis you have. Okay? You understand? There may be strains of the particular organism, so you have to use the particular, or you can have a genetic DNA technology engineered vaccines. You can have synthetic artificial peptides which will point to a particular type of antigen, or you can take out the DNA. So these are some of the types of vaccines that you will come across which are non-replicating. So if I ask you, give me what is non-replicating, and I give you some, you'll be able to answer these questions. The other one here, live attenuated vaccines basically are prepared from strains which have been attenuated. Again, they will not give you the disease that there is. They are changed. Okay? It is very important for you as clinicians that you should know what immunization process, what contraindications are there. If I'm going to give this vaccine to this person or to a child, is it going to have adverse reaction or no? Or is it be more beneficial? Has this person been immunocompromised? Are there something this patient is having? You have to look into the whole spectrum of whether they have a good protection and healthy protection, a good intact immune system before you give in vaccination. Don't just give it to anybody you like. You need a history of the patient to be seen. Yeah? What?
Is a pregnancy woman? Pregnancy woman.
No, you don't give it under, you don't give just regular immunization to pregnant women, okay? You must avoid it. I'm not going to tell you this because the same thing is happening here when I said about specific IgA from people who had hepatitis A. I've told you, you want to go to India, take hepatitis A so that you don't have diarrhea and vomiting and tummy aches and this and that for 10 days. Why you have to suffer? Just take shot and go there. And you're protected, eat whatever you like, khalli walli, no problem. Digest everything. Now, I'm not going to go into this because these are the milestone in immunization. This is not a part of your lecture. But if you have these slides are there, look what happened, why the first vaccines was created. This will give you an insight into the vaccination process that has happened. I told you, don't tell me you gave me extra slides. Come back after 10 days and say you gave me extra slide. I'm giving you this for your knowledge only, nothing to do with it. This is your extra reading if you want to see for yourself, okay? I don't want a British ambassador's wife here because her son had smallpox. Now, there are certain diseases which have been eliminated from this world. One is the smallpox. Why? How? Tell me. Let's see how intelligent you are. I know you are intelligent. I want that extra intelligence. Why certain diseases have been wiped out from this world? Aye? Come on, speak. No problem, even if you're wrong.
Doesn't replicate like other
La, 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 la.
What's the question?
Why certain lethal diseases have been eliminated so far?
Can't kill them, kill.
Aye?
Can't kill them, kill.
Oh, come on, go beyond you a little bit. Why? If you have been vaccinated against a smallpox, which I have been, and if every population is vaccinated, they will have no smallpox anymore in the world. Polio has already been eradicated because they are going into villages here, Saudi Arabia, any country, and putting polio in the mouth of the children. If they have protection, where is the organism going to live anymore? You understand? So the question here is that there are organisms present around us, and basically if you vaccinate people against it and vaccinate, they will not carry those infections anymore in the population. You understand now? If I am protected against flu virus, you are protected if you come in close contact with me. If you are all protected, then you will not get the disease. Correct? Nobody will be harmed because you are well protected. You can eradicate diseases, finish it off from the world if all the populations are actually immunized. So this is where the problem is. I'm going to leave you there. These are the early vaccines that were created. I'm not going to ask you this. This is only for, please. See, the people who have been vaccinated, okay, and you can see the incidence of, if you have whooping cough, as you can see here, you have tetanus, hemophilus, polio is already eradicated. As you can see, still there are pockets of rubella, which is German measles, mumps. Polio is already eradicated, so you don't get anything. Hemophilus influenza, because new viruses are coming into being from animals, from chickens, from birds, from whatever it is, new varieties mutating. That's why it cannot be finished. We need diphtheria, as you can see here, is almost gone. So they have been eradicated just because you vaccinated the population. Now, this is the same thing I've been talking to you. Now, the question here is, I might not ever ask you this question, but you can see, just know some of these diseases where the antibody source is humans or horse, and this is passive form. I'm not saying that you should read the whole thing, okay? Just as your normal practice of events that will happen. I leave you there, I think. Now, just read it, please. I'm going to leave you, okay? What you do is, there are many you cannot remember. There are many you cannot remember. Remember some which are oral, some which are there. Remember some which are passive, and some are active. That's all you have to remember so far in this particular lecture. In your clinical practice, you may come across, I'm not going to ask you, as I said it, please never come back to me and say, oh, you had these slides, can you say that this is not coming? I'm not going to. There are people who have come to me, all right? So please, just read it. I'm not going to ask you these details, and to be honest, I don't remember all the details myself, okay? But, somehow with your intelligent brain, you might just pick up one or two and say, oh, this is important, this is important. What is this? Is it active? It is passive? It is whatever it may be. All right? Here is your toxins. Here is your toxoids. Okay, forget it. Now, I have to go. Now, you see what will happen is that these are some of the properties that you will see in adverse reactions, especially with, what is this, DTP? Come on, tell me. What are DTP? Everybody looking at me. Name the vaccines. DTP. Diphtheria, tetanus, pertussis. Okay? All right, khalas. Take it easy.